So, Excellencies, ladies and gentlemen, first, I would like to welcome you all at the side event of the group of friends in support of water, sanitation, and hygiene in healthcare facilities. With the permanent mission of the Philippines and the WHO, we are very grateful for your participation and support. Water, sanitation, and hygiene services in healthcare facilities are fundamental for the provision of quality, people-centered care. The lack of these essential health services impacts nearly 2 billion people, notably women and children, as millions of mothers around the world face the prospect of giving birth in facilities without adequate wash services. Inadequate wash and waste management in healthcare facilities increases the likelihood of healthcare-associated infections and contributes to antimicrobial resistance. The global spread of COVID-19 draws further attention to these risks, given the importance of wash and waste services for effective infection prevention and control, health worker safety, and the continuity of essential services. As cross-cutting functions that involve multiple ministries and generate many positive externalities, wash and waste services in healthcare facilities are often chronically underfunded, without explicit prioritization by governments and partners, as with other common goods for health. The lack of funding for wash in healthcare facilities undermines sustainable services. More support is needed at the country level to assist in understanding costs, budgeting opportunities, and viable financing mechanisms. Fully functioning wash services in all healthcare facilities are indispensable to universal healthcare in this time of grave pandemic threat and beyond. It is promising that we have tools to counter these challenges. Hungary is party of the Protocol on Water and Health to the Water Convention, led by the WHO, Euro, and UNECF. The protocol had a dedicated program area to the advancement of wash in healthcare facilities in its program of work for 2019-2021. Hungary was proud to be co-leading this program area with Georgia and the Republic of Moldova. The work under the protocol focused on supporting parties in situation assessment of wash in healthcare facilities in their countries. Hungary, well known for its long tradition and extensive knowledge in water-related issues and for its highly developed water technologies, is committed to the improvement of wash in healthcare facilities, both internationally and at national level. In 2020, Hungary dedicated nearly $6.5 million to water sector projects in developing countries, the majority of which was channeled to Laos, Indonesia, Serbia, Mongolia, Albania, and North Macedonia. With this, Hungary's official development assistance increased to over $418 million in 2020. Let me briefly introduce some of these successful projects. In cooperation with Hungarian firms, Hungary equipped 3 schools in a refugee settlement located in Uganda with innovative potable drinking water systems, providing clean drinking water to 40,000 people, mostly children, per day. We also provided mobile purification systems to Kyrgyzstan to support their peacekeeping efforts, and equipped a town in Iraq with a water treatment plant that supplies locals with 200 cubic meters of drinking water a day. With this introduction, I'm looking forward to learning more about country practices and good examples on how to integrate WASH into regular health sector planning and improve on existing WASH services. At today's event, we will explore ways to implement costed national roadmaps and share expertise on economic losses and gains, as well as budgeting opportunities associated with WASH in healthcare facilities. Thank you for your kind attention, and with that, Now I give the floor to Mr. Werner Obermeier, Director of the WHO Office to the United Nations, who will be moderating today's event. Dear Werner, the floor is yours.
Thank you very much, Ambassador Hobart. It is really a privilege to be here today for us in the World Health Organization. I want to specifically thank you and Ambassador Manolo, the permanent representatives of Hungary and the Philippines, who are co-chairing this important group of friends, for bringing us together to share some experiences on the economic value of investing in water, sanitation, and hygiene in healthcare facilities. Excellencies, friends, as you have heard, I have the pleasure of spending my lunch break moderating this event with all of you. If anything goes wrong, then please blame me. I trust nothing will go wrong because we are in good hands of many colleagues behind the scenes. Let me start the proceedings by inviting His Excellency Karl-Henrik Chua, Secretary for National Economic and Development Authority of the Philippines, to deliver a keynote address.
Excellencies, distinguished speakers, partners, and guests, a pleasant afternoon to all. In December of 2021, the Philippines, Hungary, and the World Health Organization launched the Group of Friends in recognition of the role of water, sanitation, and hygiene, or WASH, in achieving our health and sustainable development goals. WASH is fundamental in preventing premature deaths and avoidable diseases among mothers and children, and is an important component of the ICPD Program of Action. In 2015, the WHO reported that proper hand washing and disinfection of surfaces decrease the risk of infection by up to 25%, while access to safe drinking water contributes to better child growth and development. Globally, 1 in 3 healthcare facilities lack safe hand washing or hand hygiene services at points of care. 1 in 4 lacks water services, while 1 in 10 lacks sanitation services. The situation is worse in least developed countries, with 50% of healthcare facilities without access to basic water services, 74% without adequate hand washing or hand hygiene services at point of care, 37% without basic sanitation, and 30% without basic healthcare waste management. The COVID-19 pandemic has underscored the urgency of providing universal access to WASH facilities, since the lack thereof increases the risk of acquiring the virus and other infectious diseases. Gaps in WASH in health facilities around the world amidst the pandemic magnified risk for around 1.8 billion people working and availing care in these facilities. On the other hand, the COVID-19 pandemic triggered rapid action on WASH in some countries. In Rwanda, for instance, the government collaborated with the World Vision to provide hand-washing facilities in hospitals, healthcare facilities, schools, and places of worship, while in Ethiopia, billions of dollars were mobilized to support WASH activities in high-load hospitals. In the Philippines, the WHO and UNICEF's joint monitoring program for WASH reported in 2019 that 1 in 4 healthcare facilities in the Philippines lacked basic water services, and 1 in 5 had no sanitation services. To address this and realize our goal of universal access to safe and sustainable water and sanitation by 2030, the Philippine government crafted the Philippine Water Supply and Sanitation Master Plan, which calls for a total investment of around 1.1 trillion pesos or around $20.4 billion. While rather, we are also pushing for the creation of the Department of Water Resources, which will unify our fragmented water sector and spearhead the implementation of this master plan. The country's Ministry of Health also developed the Green and Safe Healthcare Facilities Manual in 2020 to set the minimum WASH standards for all hospitals and other healthcare facilities, including village, and rural health units that provide primary care in far-flung areas. With clear policies and a unified framework in place, we look forward to more investment and participation from the private sector, the international development community, as well as local and national agencies in realizing these plans, policies, and initiatives. Achieving universal healthcare for all warrants the provision of basic WASH services in all health facilities. This entails deliberate integration of WASH in health sector planning and in overall infrastructure development, as well as capacitating human resources. Today, we have the chance to learn from the best practices of member countries and development partners. I am optimistic that this dialogue will help strengthen our cooperation to achieve better WASH outcomes globally and create change that is truly transformative. Thank you, and I look forward to a fruitful discussion.
Thank you very, very much, Secretary Chua. I now have the pleasure to hand over the floor to my colleague, Dr. Maria Neira, who is the Director of Environment, Climate Change and Health at the World Health Organization. And her remarks will conclude the opening segment. Maria, you have the floor.
Thank you, Werner. A pleasure to see you and to see all the friends around. You are sacrificing your lunchtime. Here in Geneva, we are sacrificing a nice sunny evening, and those are not very common. So we do this for the washing healthcare facility, which is extremely important. Let me start on my reflections with a big applause. Let me applaud those countries and their leadership, because we need their efforts and at the country level if we want to advance on this. In 2019, all the 194 WHO member states, they formally committed to ensure universal WASH in healthcare facilities and specifically outlined 8 key national actions to achieve this goal. It looks something that in 2022, we still need to remind everyone that we still need to achieve WASH in healthcare facilities. I know that it might be a little bit frustrating at some times. And still, some of those actions, such as updating national standards to include climate resilience, which needs to be included now, in environmental sustainability, great progress on that has been made. For others, unfortunately, such as ensuring that WASH and waste services are included in regular health budgets, or much more progress is still very much needed. But WHO and UNICEF are still very much committed to track and regularly report on this progress to the Global WASH in Healthcare Facilities Knowledge Portal. And also we will keep providing regular updates on WASH and waste services through the WHO-UNICEF joint monitoring program. At the same time, WHO and UNICEF, we rely on your country leadership, and like all of you in the Friends of WASH and healthcare facilities, you need to continue to advocate, to innovate, and of course to encourage a stronger monitoring, programming, and investments in WASH and healthcare facilities. Because I said that I wanted to applaud, let me in particular commend the 3 countries that were speaking today, Ghana, Hungary, and the Philippines, for their important work in this issue. Hungary, for serving as a regional leader and working through the European Protocol on Water and Health to strengthen monitoring and improve WASH and waste services, with a particular focus on infection prevention and control and stopping the spread of antimicrobial resistance. Philippines, for developing and implementing climate resilient WASH and energy standards, all with a focus on better primary healthcare services. And Ghana, because they use the COVID-19 funding and attention to prevention, to strengthen the community engagement and monitoring in order to realize the key goals in their national strategy on WASH and healthcare facilities, we know how important the investment is in WASH for good health. And we know as well that it makes economic sense and that we can advance the climate and environmental effort, but still we need the collaboration and WHO in collaboration with the key partners like UNICEF, World Bank. We have led a global price tag analysis on WASH in healthcare facilities, which has just been published in the Lancet Global Health. And I hope everybody has the opportunity to read it or to have a copy. And if not, please let us know, because it's a very interesting and important one. The results in that paper are encouraging. We know now the global cost over 10 years to ensure all healthcare facilities, for them to have basic WASH is 9.6 billion US dollars, which amounts to, if we put it all together, is 0.60 USD per person per year. Imagine. So somebody was saying that it's a little bit less than what Elon Musk has spent on buying Twitter. Anyway, we could provide WASH to all the healthcare facilities around the world. But at the same time, such investments will result in an impressive economic gains in infections averted, in lives of mothers and newborns safe, and better performing the healthcare workers. And furthermore, for climate in particularly, we now have an important opportunity through the framework being put in place to support the 55 countries and counting that are committed now for their COP26 on low carbon and sustainable health system, to include indicators, programming, and resources for climate resilience and sustainable wash and waste, alongside energy in healthcare facilities. To finalize, let me tell you that we are very committed. I mean, WHO is very committed to first through the WASH in Healthcare Facility Task Force, which is a multi-stakeholder group of leaders co-facilitated by WHO and UNICEF. WHO is working to encourage and hold accountable national governments to achieve the objectives established by WHO 72.7 and SDG 3 and SDG 6. And we are committed as well to reinforce our calls for a strong health leadership. We need to mobilize those political leaders at global events like the G7, G20, the UNGA. We count on you for that, and work at the country level to increase demand. We need to finance and integrate WASH in health programming and reporting. That's why the Friends of WASH in Healthcare Facilities is such an important and synergistic group to the task force, and we look forward to continue to collaborate together. Second, WHO will continue to provide technical support, and we encourage all countries to progress on the practical steps, sharing progress for reporting on the tracker and thought regular joint monitoring programming SDG 6 report. Third, WHO and UNICEF, we just launched the new state-of-the-art training and implementation package, WASH Fit V 2.0, and will work to support effective rollout and integration of this tool into existing quality improvement efforts. Make sure that you all have this tool as well, and if not, we will send it to all of you, because it's very useful for improvements, and then demonstrate that we can have climate smart, gender sensitivity, and in particular serve the needs of women and children. So please explore how this tool can be useful for you and adapted to your needs. So let us redouble our efforts. We still need to collaborate, work on a very effective, and ensure that the 21st century, no woman has to give birth in a healthcare facility without water or toilet. I feel even embarrassed to say that. So Werner, thank you very much to all the colleagues who have contributed to the Friends of WASH, and thank you very much. Over to you, Werner.
Thank you very, very much, Maria. Friends, this has been an extremely strong and powerful opening segment. As you have heard, the situation in terms of WASH in healthcare facilities is very troubling, and the needs are severe. But frequently, if you face problems and nowhere to look, there are solutions abound, and the solutions are not expensive, as have been illustrated by the numbers that we have heard. The economic benefits, obviously, of investing in sanitation are on average 5 times the cost, and improving hand hygiene can generate savings in health expenditure of up to 15 times the cost. These investments in water, sanitation, and hygiene are key to healthy and productive populations. WASH is a global public good, and as COVID-19 has shown, we have no time to waste. We can get it right with sustainable financial investment, integrated policy formulation, and community involvement and accountability. We can make safe water, sanitation, and hygiene a reality for everyone. Let's now turn to the panel discussion and hear about the experiences from countries, from agencies and the private sector on ways to integrate WASH into regular health sector planning, budgeting, and programming, as well as some examples of implementing costed national roadmaps for water and sanitation and hygiene in healthcare facilities. While the panelists are speaking, I encourage all participants to post questions and comments you may have in the chat box or use the Q&A function, because we are planning to have some time at the end for the panelists to respond to queries and observations you may have. First, it gives me great pleasure to turn to Dr. Mary Eriem Ashinyo, who is the Deputy Director at the International Care Division in the Ghana Health Service. And she is going to give us some examples from her country in implementing costed national roadmap. Dr. Ashinyo, you have the floor, sister. We see your slides, but we are not hearing you.
Yes, please. So good evening, Your Excellencies, distinguished panelists and colleagues in the WASH space. Greetings from Ghana. My name is Mary Ashinyo. As rightly introduced, I'm one of the deputy directors in the Institutional Care Division Health Service, managing national IP WASH program. So I'm wearing the cap of the national focal person for this program to do this presentation. So it's really a privilege to be part of this meeting to share what Ghana is doing in terms of WASH in healthcare facilities, focusing on the status of WASH, but also bringing to life some of the experiences we've had with implementing our national WASH costed strategy as we talk about the economics of WASH. So to do that, I'll give a little introduction, then go straight into the status of WASH in healthcare facilities, and then highlight some country efforts, talk about some of the challenges we have faced in the implementation, and then I would conclude with some reflections on the economics of WASH. So Ghana is located in West Africa. It's bounded by Burkina Faso, Cote d'Ivoire, and Togo. We have a population of a little above 30 million, and our life expectancy is about 63 years. For the health sector, our vision is to attain a healthy population for national development, and our mission is to work towards the achievement of healthy lives. It's such a long one, but ultimately working with all stakeholders to achieve the highest quality of care in a more coordinated manner. But our goal is to promote and restore health to all the people living in Ghana. To be able to attain this goal, Ghana has a very pluralistic health service, health sector or health system. We see that our agencies, which are over 21 of them of the Ministry of Health, are classified into service providers. There are also regulators, there are finances, and then there are people who are into education. Then our NGOs and CSOs who are also in the health space. So in terms of WASH in healthcare facilities, the Ghana Health Service is the largest service delivery agency of the Ministry of Health, responsible for more than 70% of health service delivery in Ghana. But in terms of regulators, we have so many regulators, those who regulate professional service delivery. But most importantly, for WASH in healthcare facilities, the main regulator would be the Health Facilities Regulatory Authority. That gives accreditation to healthcare facilities to be able to practice in Ghana. And part of the criteria to get that accreditation involves WASH and IPC in healthcare facilities. We also have the National Health Insurance Authority that is responsible for credentialing facilities after they have received accreditation to be able to provide services to NHIA clients. And on their checklist, one of the key criteria section is on WASH in healthcare facilities. And then we have health training institutions that also prepare our health workforce. Part of their curriculum include WASH in healthcare facilities. And so with all these diverse stakeholders in the WASH space, which is just a subset of health service delivery broadly, we see that there are so many voices when it comes to what WASH feels like in Ghana. Policymakers think that a lot has been done, but there's still need for data. There are funding gaps. But the one that I find very interesting for today's discussion is the one from patients. They say that sometimes washrooms are locked and you have to pay. And for me, this is very important because usually when we talk about economics, we are focused on the macroeconomics. But for WASH, this is a very good example or a reflection of microeconomics in WASH. So I will now show you how WASH looks like in terms of the figures. Ghana introduced routine quarterly reporting of WASH IPC indicators in 2018. So last year, as of the end of 2021, we tried to look at the data by the third quarter of 2021. We all know that WASH is very important. The gaps still exist, but it was not too clear what the status of WASH was across all 16 regions. So what we did was just analysis of the WASH database in this district health information management systems with full funding and technical support from the World Health Organization. So the data I'm going to show you right now is data from over 2,000 healthcare facilities, which includes hospitals, but also non-hospitals. So on the left, we have indicators that on which I'm going to show the results that we have. These are indicators that healthcare facilities have been reporting on since 2018. But on the right are also new indicators that we have introduced this year with new focus on urban-rural distribution, also on staff who are trained and making sure we don't leave anyone behind. There are some staff that we have realized are not really involved in the WASH business. Then we are also focusing on budget that is allocated, budget that is approved, and budget that is actually spent, because we realize there's a huge gap when it comes to WASH financing, data on financing. Then we have also now introduced indicators for gender, indicators, additional indicators for governance for WASH and IPC, and then also with an additional focus on healthcare-associated infections and antimicrobial resistance. So in terms of governance, we see that about 45% of our healthcare facilities have action plans every quarter. About 61% of them have focal persons that are available in that healthcare facility, but just about 54% of them are trained. Then we also have facilities having about 46% of them who have assistant focal persons. Now, let me show you how the water trend has performed over the years since 2018. So in 2018, as of the last quarter of 2018, proportion of healthcare facilities with basic water services was about 38%. But due to the huge investment as part of the COVID response, we now have 55% of healthcare facilities having basic water services. Similarly, for sanitation, we had 39% of healthcare facilities by 2018 last quarter. But as we speak, we have 50% of healthcare facilities with basic sanitation services. For hygiene services, we had just about a little above 30, about 33% of healthcare facilities with basic hygiene services around 2018. But as of last year, we now have almost 60% of healthcare facilities with basic high hygiene services. Now, for waste management services, which I would say is the least performing of the domains in Ghana, we had in 2018 less than 30% of healthcare facilities with basic waste management services. And even with the huge investment from the COVID response in waste management, we still have just about 40% of healthcare facilities having basic waste management services. So this slide is a summary of what I have said, but I'll focus on just the one on the extreme right, which is talking about the 21% of chiefs having basic water services, for instance, just to show that there are still inequities when it comes to the level of care. So we are talking about hospitals who have really good indicators. If you just look at only hospitals, you'll be having close to 80% of hospitals having basic services. But when you move to non-hospitals and closer to the communities, there are huge gaps, which is very indicative of inequities. I would say that Ghana has made a lot of efforts together with our partners in improving WASH in healthcare facilities. For instance, in the area of policy, we have national WASH IPC policies and technical guidelines. We also have policies on IPC and WASH related programs like antimicrobial resistance, patient safety, healthcare associated infection, and other health WASH IPC related programs. But the one that I'll be talking about shortly is the national costed strategy, because we didn't just develop a strategy, but we went ahead to cost it, because sometimes stakeholders want to support, but the question is how much will it cost to bridge the WASH gaps in healthcare facilities? In terms of training content, we have tailor-made modules for clinical staff, non-clinical staff, and even managers. In terms of tools, we have taken very remarkable steps in streamlining the various and different tools that are deployed by different partners. And currently we have adapted WashFit, which is our flagship tool for quality improvement, and have also standardized our job aids and protocols. In terms of monitoring, we are continuously building capacity of hospitals to report in the district health information systems every quarter on the GMP indicators. Occasionally, we also conduct field assessment, surveys, and compliance assessment. For capacity building, we now focus a lot on private sector as well, with support from WHO, UNICEF, and our partners. For integration across programs, it's one of the things we have seen, or a pathway we have seen, to make sure that WASH becomes everybody's business. So we have started integrating content into training materials for neglected tropical diseases program, for instance, for the WHO Quality of Care Network, for nutrition programs, for antimicrobial, One Health platforms, cholera, all programs that we think that WASH must be integrated. We are taking steps to do that. We are also really empowering the communities, because we realize that communities by themselves can actually diagnose the gaps in wastewater surveillance during the COVID response, healthcare worker safety risk assessment. But we see greater opportunities in WASH economics, because this is an area that we have not done a lot of research. So it's very important that we are also identifying that as an opportunity to look at. Now, Ghana's national WASH costed strategy, it highlights 4 key areas, and these include minimum standards, infrastructure and costing, human resource, funding, and sustainability for WASH. Today, I'm going to speak briefly on 2 of them, because I see they directly relate to the economics. Ultimately, what the strategy is seeking to do is to provide the context and legal framework for WASH in healthcare facilities in Ghana, but to also provide a framework for sustainable implementation of national guidelines, to integrate WASH into routine M&E system of the ministry, and to provide a strategy for sustainability and scale-up at all levels of care. So yes, Ghana has a national costed strategy. The methodology that we use to develop this costing is the life cycle cost approach, which makes sure that all costs, including all capital investment costs, replacement, rehabilitation, etc., are all catered for in the costing process. We also have noted that in Ghana, domestic funds constitute about 89% of healthcare financing, and yet almost more than 90% of WASH services is donor funded, and that is really not good enough. So realizing that sustainable financing models depend largely on domestic funding for continuous delivery of WASH services, the strategy has now highlighted sources of funding for WASH, and that includes internally generated funds in our healthcare facilities. So in Ghana, the healthcare facilities are allowed to spend all the funds that they generate, and we think that part of that should be directly allocated for WASH. We also realize that local assemblies, through the district assembly common fund, the health is under the social department of the district assemblies, and so they also have a role to fund WASH. Our development partners have been key, the NGOs and private sector. So this is a snapshot of the various components of the costing that Ghana did as part of our costed strategy. So what are we costing? We are costing all the domains of WASH. For instance, in terms of water, we are looking at drilling and mechanizing boreholes. How much will it cost to be able to establish? We are also looking at toilets and urinals for sanitation. In terms of construction of a 2-unit water closet, how much will it cost? We are also looking at operation and maintenance and recurrent cost items. For instance, if you want to institute a refuse disposal, how much should it cost? Hygiene promotion in a healthcare facility, how much should it cost? So these figures are in Ghana cedis, but the one that I want to show you is the one that summarizes what it will actually take to bridge the entire gap of WASH in healthcare facilities in Ghana as at 2020 when this strategy was finalized. And that is about 162 million Ghana cedis, which at the time was about $40 million. But with the rate of Ghana cedi to dollars now, I would say that we roughly just need a little above 25 million US dollars to be able to bridge the gap of WASH funding in health sector. So what have been some of our challenges or our experiences with implementing this costed strategy? We see that the multiple tools that we deploy into the field and even the duplication of same efforts threatens efficiency. And so we complain that the sector is not really funded, but there's still a lot of duplication. And if we are able to manage this very well, we will be more efficient and be able to invest the money we save in other areas that are not doing very well. We also see that there are bottlenecks of WASH logistics procurement. So our hospitals sometimes find it very difficult to even have access to color-coded bins and bin liners. So what can we do? Suggestion is to pull it together into procurement at a national level, and this will be distributed. And when we are procuring in large quantities, then it becomes cheaper, but it also makes sure that there's access to the right quality of this product. Our major challenge is also the data on WASH financing. It's a big problem. Now that we have included indicators in the district health information system on funding, we are hoping that we would now be able to bridge that gap when facilities start reporting, which will be from this quarter. We have challenges with data completeness and capture into DIMS itself. As we speak, the reporting rate is about 26%, which means that we still have as high as 76% of healthcare facilities not reporting into the database, and that is worrying. Human resource challenges, we do not have adequate staff who clean, and so that certainly is a challenge because sometimes nurses have to come to work and do the cleaning by themselves, and that in itself also threatens infection prevention and control. Then we have operational difficulties. Sometimes just vehicles for officers to move from one level to the next lower level to offer supportive supervision is a problem, and those are some of the challenges that we have. So some contextual reflections as we advance the discussion on the economics of WASH. is that there's a need to emphasize that the economic gains might not only be monetary, but also the health gains for each unit of investment in WASH. And I was happy when the chair mentioned some of the indicators, some of the figures. In Ghana, we must also take those opportunities to, be able to answer questions. For every dollar investment in WASH, how many dollars are we averting, for instance? Private sector's role, private sector is a very huge opportunity to improve WASH in healthcare facilities. But as we know, as our experience in Ghana has been, private sector is profit making versus government that is non-profit making. And so if we are talking about UHC and health for all and taking off financial barriers, then we have to really have a way, a framework that really allows us to increase access through private sector when we want to engage private sector. Funding gaps remain a very critical challenge to the national strategy implementation. And maybe we are even underestimating the funding gap because we don't even have the data quality is an issue. Now, WASH is also reflecting the global health inequities that already exist, but also within country, we are seeing the geographic inequities with WASH and not only the broader service delivery as we have always seen. Now, stakeholder mapping and their roles is very important because there are so many stakeholders that sometimes we have not even mobilized. I would say that from 2018 to 2022, as we speak, now we have over 20 partners who fund WASH, but previously we had just less than 5. And so we had to look out for who is in the WASH space and who is interested in funding. So stakeholder mapping and roles, very important, but not forgetting the fact that our communities play a very critical role. And in Ghana, we have seen this very, very palpable, very, very something that we want to highlight. So these are a list of our partners. We want to acknowledge them for their, very important contribution to the WASH sector. And also to acknowledge the other partners that we work with who don't necessarily fund, but they provide a lot of technical support. Thank you so very much for your audience. Thank you.
This is excellent, really, really good. I appreciate that you joined us all the way from Ghana. Before you turn off your camera and have dinner, there are 2 questions in the Q&A for you. Maybe to save time, so we don't need to address it at the end. If you would care to respond, the one question concerns private sector engagement in Ghana in supporting WASH, and the other is a question related to what role WHO and UNICEF has played in supporting you in your activities on WASH in healthcare in Ghana. So I appreciate if you respond to those while we move to the next panelist, which is Dominic O'Neill. He's the Executive Director for Sanitation and Hygiene, the fund in UNOPS. I think most of you will know that UNOPS is the UN Office for Project Services. They are based in Copenhagen, and they do a lot of work on managing projects and services in support of the Sustainable Development Agenda across the world. Dominic, you have the floor.
Thank you, Chair, colleagues, Excellencies. That is a very difficult act to follow. Just want to congratulate Dr. Shino from Ghana. Fantastic work happening there, and certainly an example for the rest of us to follow. Thank you for the introduction. The Sanitation and Hygiene Fund is relatively new. We became operational in July last year with the mission of mobilizing finance into the sanitation, hygiene, and menstrual health issues. We are using a model where we focus on the sanitation economy and the opportunities within that. So this very much talks to the need, as Maria mentioned, in terms of how we can raise the $6.5 to $9.6 billion that is required. So I think, just to start, any healthcare facility without WASH facilities is not a healthcare facility, as in the same with a school. So I think we should start with that as a premise and look at and consider WASH in healthcare facilities now as critical infrastructure. If ever there was a reminder, then COVID was it, but it was important even before COVID struck. And the challenge is not only financing, but it is a large challenge. And I think Dr. Shino from Ghana has demonstrated the full range of leadership and issues that are required, from financing, management, organization, prioritization, involvement and participation of staff. And it was a wonderful example. And that would be my main message, that WASH should now be considered as critical infrastructure in healthcare facilities and given the necessary priority in public investment planning as well. I do think, in particular on the capital investment, it's impossible, I think, for the healthcare facilities themselves to plan for that level of investment. And so it's really important that it's at the central level, at the local level, that it's given sufficient priority in capital budget planning. Obviously, operation and maintenance then needs to be included, and that can be included in running costs and budgets. But I'd also, and I know one of the questions about the role and the involvement of private sector, I think that there's a lot of opportunity, potentially even in some situations for private sector investment, but certainly in the operation and maintenance, I think it's really critical that we stimulate the private sector to take an interest in and to build their own capacity to provide operation maintenance support and facilities to healthcare centres. It's not always reasonable to ask certainly larger facilities, healthcare workers, to do that alone. Chair, I'm going at a reasonable pace. I know there's several speakers behind and I want to ensure they give sufficient time. The Sanitation Hygiene Fund is prioritising this. Investment in healthcare facilities is one of our 4 strategic areas. We're very much looking at this through the lens of the sanitation economy. To give you an example, the sanitation economy in Nigeria alone is worth $15 billion. And that's not to say we're just looking at economic outcomes, but these are economic opportunities where jobs can be created, SMEs can be created, not only to build the initial infrastructure in healthcare facilities, but also to provide the operation and maintenance. I think that's a really critical gap. As was noted in Ghana, 90% of the WASH funding is from donors. And you know, this is a budget that's under extreme pressure. And what we must do is activate and catalyze, you know, use the existing donor financing as smartly as possible, but to, you know, maximize and catalyze local financing opportunities. As I've mentioned already, through public investment budgets, and I'm sure our colleague from the World Bank will talk to that, getting the MDBs in terms of their lending instruments to ensure that this can be incorporated. These aren't small amounts when you look at it, at what's required at a national level. So yeah, that's going to be our approach. We will work with partner governments. We're currently working with 6 startup countries. We'll be helping them to build on the work that the WHO and UNICEF has done already on the joint monitoring program. We will be funding the WASH accounts that has been mentioned. So critically, to have the transparency over what are the investments going in, public and private, investments going into the WASH sector, and how can those be catalyzed and leveraged even further to get maximum effect. We'll also be supporting the mutual accountability mechanism, because it's important that the users of healthcare facilities have a clear and strong voice, because they can bring about a lot of the change that's required. Chair, I'll leave it at that, given the other speakers behind, but just to thank you for the opportunity and encourage all of the participants and panelists that it's now time to change the way we deal with health, sanitation, hygiene and healthcare facilities. And I don't want to forget menstrual health as well, which is an important element which needs to be incorporated and mainstreamed. Thank you.
Thank you very much, Dominic, for joining us. Let me now move on to Claire Chase, who is the senior economist in the World Bank's Global Practice in Eastern Southern Africa. As you all know, without infrastructure funding, service delivery cannot be scaled up adequately anywhere. And so, Claire, tell us where the money is coming from.
Thank you so much, Honorable Chair, and a really fascinating discussion. I'm very happy to be here. I have a couple slides, which I'm not going to speak directly to, but this just presents our in the water practice jointly with the health practice, our work program on WASH and healthcare facilities. But I'm going to just focus on the financing aspects of this, as that's the topic that we're discussing today. So we at the World Bank join our development partners and government clients in the recognition that every healthcare facility across the world deserves to have functioning WASH facilities as a matter of critical importance for dignity, equity, and quality of care. So after the global call to action and resolution in 2019, we went back and took stock of where the World Bank was investing in WASH and health facilities. And as part of that exercise back in 2019, pre-COVID, we identified activities in at least 20 countries across all of the regions that the bank is working in partnership with government to finance WASH and health facilities. And that included projects both in the water and the health, nutrition, population practices. Now, clearly the lack of functioning water and sanitation and hygiene protocols was a huge concern in the face of COVID. And so that figure that I just mentioned has now increased to a total of 53 countries where the bank is supporting WASH and health facilities. So more than half of the projects that we're now seeing across the portfolio were financed as part of the bank's so-called fast-track financing in response to the pandemic to address these deficiencies. And that was clearly shown by Dr. Ashima, right, the increase in access to WASH in healthcare facilities that was seen in Ghana after the pandemic. So the pandemic was really a step change in the scale of financing for WASH in healthcare facilities, and we really don't want to lose that momentum, especially as we continue to face risks from COVID, as well as other emerging infectious diseases with pandemic potential. Not to mention the broader health and development impacts of improved WASH in healthcare facilities. So more can and should be done to advocate for greater financing from country governments, as was mentioned, right? And to leverage also the existing resources that are going towards this effort.
Claire, we lost your voice. The sound is gone.
I think I'm back. Sorry about that.
There, you're back.
Can you hear me now? Yeah, just dropped for a second. So what I was saying before it dropped is I just want to share 3 ways that the World Bank is approaching the need for more financing of these urgent needs. So the first is really around internal advocacy. How can we influence the lending of the bank and the policy reforms that the bank is supporting through inclusion of WASH and health facilities as one of the key priorities? And this is similar to what was done under the COVID response projects, where WASH and healthcare facilities was seen as one of the critical activities as part of those projects. And so we're looking at opportunities such as the bank is putting together an operational framework for antimicrobial resistance, where WASH and health facilities is one of the key interventions to address AMR. We're also looking at including WASH and health facilities as one of the key interventions under the Human Capital Project, which was started in 2018. This is a cross-country initiative where WASH and health facilities is one of those actions that can help to reduce morbidity and mortality that are associated with human capital improvements. And then finally, there's the bank is discussing a new package for health emergency preparedness. I think the financing for this is still under discussion, and as we've seen, a lot of priorities are changing because of the war in Ukraine and the knock-on effects of that. But we are looking at the potential for WASH and health facilities as part of this new package for health emergency preparedness. And all of these really take advantage of funding windows that are there, such as there's huge resources under IDA and IBRD financing, but also looking at ways to complement through trust funds such as the Global Financing Facility for Women, Children, and Adolescents. So the second area of our focus is really on national level advocacy. So again, World Bank financing is supporting government priorities. Governments need to, in most cases, governments are borrowing money. So they need to express these priorities. And so here we really see opportunities to work together with partners to prioritize WASH and healthcare facilities, particularly at the level of ministries of finance, because the ministries of finance are, of course, the ones that are coming with the request for financing. And so doing this in partnership with UNICEF, WHO, WaterAid, and other development partners, and building on this evidence and using this evidence, particularly the article that's been mentioned on the costs of universal WASH in healthcare facilities is a great tool to come to those ministries of finance and advocate for investments. And then the final approach that we're taking is really trying to make the most of the existing resources. And I think this was mentioned previously, but we have 53 projects currently in the portfolio that include WASH and healthcare facilities. So how can we enhance those existing projects and efforts to ensure that we're seeing the best outcomes? So we saw through the inventory that I mentioned early on that was done in 2019 that many of these projects were not always addressing the need for a full WASH package. So they might be financing sanitation or they might be financing water supply. But what more can we do to ensure that we have this full package of WASH investments? And then also ways to improve the functionality and sustainability of services. So many of our health projects, while they may not be ready to include the capital investments for new infrastructure, they can certainly include measures to ensure that that infrastructure is functioning and that behaviors are in accordance with the WASH, basic WASH services. And then this is also supported by, and you can go to the next slide because this is a big effort that we're now working towards, is this WASH and operational toolkit for WASH and healthcare facilities. And this is really supporting what I mentioned around higher quality implementation. So supporting projects and client teams to make sure that we're not just doing the basics for these investments. Oh, there's always going to be an assessment, there's always going to be procurement, but what can we do on ensuring that we have the right management models for the functionality, that we're addressing advocacy and behavior change as part of those activities. So the toolkit is aiming to support the higher quality implementation on the projects that we already have. So let me just close by emphasizing these are all areas where I believe we can work together to garner more resources for this effort and really to make the best use of existing resources. And I look forward to further collaboration and partnership with many of you. Thank you so much.
Great. Thank you very much, Claire, for joining. To bring the World Bank's perspective, I think it's really very important to hear how the bank is also leveraging many different sectors in supporting WASH in healthcare facilities. I want to now ask Kelly Ann Naylor, who is the Director of WASH and Climate, Energy, Environment and Disaster Risk Reduction in UNICEF. That is a very busy portfolio, so I'm happy that you are joining us this afternoon. UNICEF has been mentioned by several people. There have also been some questions in the Q&A about UNICEF's role. Thank you to the panelists for already responding to those questions. Kellyanne, tell us, what are you doing in UNICEF?
Thank you very much, Werner. Good afternoon, good evening, Excellencies, colleagues, and friends. And I'm really delighted to participate on this panel today. And I think just this event is absolutely coming at the right moment, as really together we're really seeking to accelerate progress on water, sanitation, and hygiene, and link it together with this drive for WASH services in healthcare facilities everywhere. So from UNICEF, UNICEF perspective, we are a multi-sectoral agency that, of course, is dedicated to children. So we cover areas that span health, nutrition, education, child protection, social policy, and water, sanitation, hygiene, and climate. So we've got a lot of sectors that we try to bring together around a common cause, which is our children. What we're trying to bring to bear on this important opportunity with WASH services and healthcare facilities is really leveraging our in-country presence in over 195 countries and the established partnerships that we have in both the health and the WASH sectors, together with key partners like WHO and the World Bank, alongside other development partners, to be able to really support governments to be able to reach these targets of universal access to WASH and healthcare facilities. And this is really our approach. And just to say, over the last 4 years, we've reached direct support to 16,700 healthcare facilities in 85 countries. So as Claire said, we've seen a dramatic increase in the attention to this issue. And this is, for UNICEF, a threefold increase from our previous cycle. So I just wanted to really start, I know we've already talked about Ghana in depth, but just really quickly, a couple examples from countries where UNICEF is working around the world in a few different regions. First, just wanted to give a couple examples from India. And in India, UNICEF has been partnered with local governments, where we've been working on a newborn care program that really looked at trying to block critical pathways of acquiring infections in healthcare facilities. And some of the types of activities that we've undertaken over the last 4 years has been training of over 6,000 health workers. We've put in place, together with the local governments, a cleanliness award where 62 facilities were recognized for their excellence in hygiene. And we've also been able to leverage domestic resources with over $1 million leveraged from local government into improving WASH and healthcare facilities. And now this program is scaling up and linking to some of the national initiatives. Moving now to Venezuela. Another part of the world in different context. And in Venezuela, UNICEF program has been working together to support 36 healthcare facilities distributing cleaning, hygiene products, hand washing points, drilling emergency water supply wells so that safe water is available at the facility. And we've also been installing chlorine generators to try to support having infection control at low cost. Quickly moving to a third example, in Africa, we've been working in Uganda, where WASH is considered a critical component of quality of care initiatives to improve maternal and newborn health. And UNICEF has supported, together with other partners, the national guidelines on WASH and healthcare facilities, as well as direct implementation of WASH services in at-risk healthcare settings. So in terms of the impact, Werner, that we're seeing, we're hearing from a survey that we did with mothers from the community that they're reporting greater satisfaction with the services and seeing an increased use. So I think it's that this is a win-win situation where we're improving the conditions and then also improving the quality and the use of healthcare services. So turning ahead to our priorities going forward, we have three priority areas that I wanted to talk about. And one is what we will continue to do. And so we will continue to work with our government partners and our development partners to provide direct support in countries and localities where there are no WASH facilities in the healthcare system, identifying where we need to take rapid assessments, where we need to repair, construct, expand expand key wash facilities, reach them with critical supplies, and ensure that infection prevention and control protocols are in place. So that's something that we'll continue to do. But we also really want to work at strengthening the systems. And so, as is mentioned, we've been working under the leadership with WHO on the Wash Facilities Improvement Tool, which WashFit 2.0, which has now been implemented in 40 countries, as Ghana mentioned, they've done it. And we want to continue to help countries to undertake a systematic approach to helping address wash gaps. And then our third and final area, really linking with the World Bank presentation and linking back to what Dr. Naira said, is we know the cost of closing the gap, and we know that financing will be an important accelerator for making this happen. And so we will continue to support translating these findings of what are the gaps, what are the costs, into costed roadmaps so that we can try to stimulate greater financial investment. So just wanted to close to reiterate UNICEF's commitment to scale up and sustain WASH services in healthcare facilities. We stand alongside our partners and will continue to act to make sure that no woman should give birth in a healthcare facility that does not have adequate water, sanitation, hygiene, environmental cleaning, and waste management services. And just to say, this is an issue that represents both a problem and a known solution. And so I think we are at a time where we know what to do and we can act, and we count on your support. So thank you very much for inviting me to this UN group of friends, and look forward to this journey that we're going to take together, which will bring obviously a better future for every child in this generation and those to come. Thanks, Werner, back over to you.
Very, very good. Thank you. Thank you so much, Kelly. And I think it's really important that you highlighted again that there are low-cost solutions. And what we are about here is to generate impact, because we are in the business of affecting and improving the lives of people. So very, very important points from what I have heard so far. I want to now appropriately go back to the field and pass on the floor to Paul Oyesigye, who is the program manager at World Vision. He's based in Kampala, I presume in Uganda. World Vision, as many of you will know, is a well-known humanitarian aid and development agency. Paul, please go ahead.
Great. Confirm that you can hear me loud and clear?
Yes, loud and clear.
Great. Yes, Your Excellencies, distinguished guests, ladies and gentlemen, good morning, good afternoon, good evening. My name, as rightly said, I'm Paul Oyesigye, the WASH Program Manager at World Vision Uganda. World Vision is a Christian organization, child-focused and community-based organization, and currently we are implementing WASH in over WASH and other programs like health, education, livelihood and resilience, child protection, and responding to emergencies across 100 countries, spanning 6 continents across the globe. It's with great pleasure to be part of the panelists this evening discussing issues of WASH in healthcare. I want to start with one of the quotation by a great American anthropologist, educator, and a great scientific writer who said, I quote, "If there is magic on this planet, it is contained in water," by Rowland Wilson. Whenever water stops flowing, the tragedy awaits. We can see this significantly what is happening in Ukraine and other countries where we have conflicts. Whenever water stops flowing, a tragedy awaits. This is made worse when it comes to the healthcare facilities. I want to share the experience from the field, and you agree with me that most of us agree that financial support to healthcare facilities in developing countries is essential to improving health, prosperity, and protecting the world from hospital-acquired infections and future infectious diseases. However, with competing priorities, it's not always the case. It is easy to let this work fall down the list of priorities. But as an organization, World Vision, being community-based, we don't have the luxury, as the need is in front of us every day. I want just to share just a brief on the findings from the recent research that World Vision conducted in 14 countries in 2020 in collaboration with the University of North Carolina. Next slide. This brings out exactly the picture. I picked the experience of Uganda, and this is how the data looks like and communicates to the need to push this conversation to another level and turn it into action by partners and government and every stakeholder. If you look at like death registered that relate from the hospital associated or acquired infections, 30% of that death was actually attributed to infections from poor hygiene and sanitation services. 19% of rural healthcare facilities at that time of this study had no water services in terms of the GMP service ladder, completely no service, water service. 42% had no hygiene services, meaning both the health workers, the patients, none was actually practicing hand hygiene. This is a great tragedy. Just imagine a midwife attending to this mother delivering and is unable to wash hands because he has just supported one mother who has just given birth and is just coming to this second mother and cannot wash hands. This is what I started with, that whenever water stops flowing, especially in the healthcare facilities, then a tragedy awaits. And a solution to this is right with us, the stakeholders that are part of this conversation, the government representatives, who can change this situation. Imagine 83% of the healthcare facilities, and these are healthcare facilities at the level of 3, where you're talking of maternity ward, health center floors, close to a hospital. But 83% of those had limited, meaning that the sanitation that was available was being shared both by patients, both sex, male, female, and the health workers themselves at the time of this study. And 90% couldn't segregate the medical waste into coded bins and treat it before disposal. So you can imagine the tragedy to the environment. And this is what really brings us together, today's discussion and conversation. A case in one of the hospital healthcare facilities, just a few steps to one of our field office in Buhimba. Buhimba Health Center 3 is just about 15 meters away from one of our field office. An expectant mother, a woman who was closed her delivery, went to use a latrine, and a step inside that latrine, as you see the picture there, a step into that latrine in the evening hours, as she tries to do exercises, waiting to deliver, steps on that slab and it caved down, it caved inside. Just imagine the cry of this mother, ready to give birth after 9 months, one leg just swinging close to the pit, in the pit, and is holding onto the door and is screaming loud for help. These are kind of cries that move us every day as we do our work and partners.
Paul, can I ask you to start wrapping up, please, because we have 1 or 2 more to follow and we cannot go too long over time.
Excellent.
My apologies.
All right. So this is one of the cases, and as we have so many other cases of mothers of healthcare facilities that are non-operational, especially the theaters, because of lack of water. A case study is one of Chikuve Health Center 4, and a theater that was unused for over 3 years just because of lack of water connection, and it could not carry out any major operation, including cesarean. And this required referring these mothers. Seeing mothers, die on the way being referred. Yet, if we had this provision of water in these healthcare facilities, such a minor and major surgeries actually could be done within the hospital. Mothers shying away and choosing to deliver instead of going to the hospital, delivering from home is one case that really should push us to another level to see that we change the situation. As I conclude, I want to say that it is possible by 2030, every pregnant mother in rural setting to be able to seek antenatal care and finally deliver live birth in hospital. If those many undocumented cries can be listened to and responded to with appropriate action, it is essential, indeed, that as we continue to improve the quality of services in the health facilities, that it comes with strong collaboration between Ministry of Water in different countries, health, and strong commitment from funders to see the health of mothers and babies are protected no matter where they happen to be born. The next slide, as I'm finalizing, I finish with this quotation from one of the great Mother Teresa. I know that we don't have all the resources to do everything at the same time, but this quotation indeed triggers us that we can do that, especially with love. Indeed, we cannot all of us do great things, but we can do small things, especially with great love. Those children you see in the last slide signify the joy of the future. If you can go to the last, signify that joy of the future that our children and our grandchildren will be proud of, because we saved their lives by doing what we need and ought to do today. Thank you very much for listening.
Thank you very much, Paul. I think it's really important what you said. Many small contributions actually have major outcomes if you collectively put those together. I want to thank everyone who participated in the event, and especially those that posted so many positive comments in the chat. I know there were 1 or 2 of you that still wanted to intervene, but we really have run out of time. Before I pass on to the other co-chair of the group, I want to thank the teams in the permanent missions of Hungary and the Philippines who worked on making this important event possible. And I also want to especially express appreciation to my colleagues Padrock and Eva Kekele, who put in a lot of hard work to make this event the success that it is. So now, to conclude the event, I have great honor in passing on the floor to Ambassador Enrique Manojo, who is the permanent representative of the Philippines, and as you have heard, the co-chair, or other co-chair of the group. Ambassador.
Thank you very much. Excellencies, colleagues, first of all, I wish to thank all the panelists for their excellent presentations and also to thank the participants who are with us today. Achieving full coverage of basic wash and waste services and health facilities by 2030 will require considerable efforts to build, rehabilitate, operate, and maintain infrastructure. Only 25% of national budgets have line items for wash and waste management in health facilities, and there's little published evidence on how it is otherwise financed. To build and sustain services in perpetuity, countries will need to plan and allocate resources within their annual budget cycle, regularly monitor wash and waste services and spending, and strengthen the enabling environment for the private sector to finance and deliver these services where appropriate. Within the health sectors, resources need to be prioritized as part of overall investments in universal health coverage and health security-oriented reforms. To further advance dialogue, governments and their partners should undertake tailored national and local cost analyses to inform routine planning and budgeting, as well as systematized practices for sound asset management. The Philippine government supports the initiatives to highlight WASH in cross-cutting development plans and strategies, especially in improving the healthcare structure. The updated Philippine Development Plan for 2017 to 2022 emphasizes the need to sustain strategic implementation of energy-efficient and disaster-resilient health infrastructure facilities, such as hospitals and healthcare facilities. One of the strategies identified in our plan is for the government to pursue water supply and sanitation policies, plans, and programs in accordance with the key reform agenda identified in the Philippine Water Supply and Sanitation Master Plan. This plan also aims to provide access to grant financing and technical capacity building on planning, implementation, operations, and sustainable management of safe water supply and sanitation infrastructure. Excellencies, progress depends upon the strong voices of national and global leaders to help make water, sanitation, and hygiene and health facilities a priority for the benefit of women, children, and all citizens. When nations commit to address this crisis, global support will follow. Again, along with Ambassador Horvat, the permanent representative of Hungary, the World Health Organization, we thank all of you for joining us today, and we continue to raise awareness and advance the importance of water, sanitation, and hygiene and healthcare facilities. We look forward to having more discussions such as this with you in the future. Thank you.
Thank you very, very much, Ambassador, and thank you once again to everyone who participated. There are one or two questions we didn't get to, but we will respond to those by passing it on to the panelists to whom they were directed. On that high note, I bid you all a very good afternoon and evening. Thank you.